Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to our live event where we are going to look at a quick topic and then start fielding all your questions. So we're glad that you can join with us this evening. I hope you'll learn a lot. I hope the time be profitable, and I hope we get to your questions as well. If you are a client of ours, we always like to hear about that and also where you're from. Delighted to have you a part of this. I do try to do this every Thursday, 5 p.m. Central Time. Tonight we're going to talk about really 5 Medicare and Social Security rules that I think everyone should know as you approach age 65. So I'm going to go through these. And just before I do want to make sure you know that you can start putting your questions in now. And just kind of one rule of thumb. Be sure that we can understand your question. I know people try to be concise and sometimes abbreviate, but don't be so abbreviated where we cannot understand what you're asking us. Okay, so make sure we can understand the question. I'd rather you put a few extra words in there to clarify what you want to know so that we truly can be helpful for you. Okay, and then also there is a number that's going to scroll at the bottom of your screen if you need help. Our office is open right now. We are Medicare brokers, and so sometimes people need some immediate assistance. We'd be delighted for you to call a 100 number. Every agent that you would talk with, I personally trained and helped them in their Medicare knowledge and understanding of really how we do business, and so I think you'll be treated very well. And so please call in if there's something that you need immediate assistance or just continue to learn about Medicare. All right, so the name of our company is MedicareSchool.com, and the goal of our company has always been to be the nation's most trusted resource for Medicare education and enrollment assistance. And we have a company of 90 people every day throughout the country that are accomplishing that goal, helping people to understand Medicare before they start making choices. And then once they understand exactly what their options are and what's the best fit for them, then we help people enroll into Medicare A and B, enroll into whatever insurance product is a fit for you, whether that's a supplemental plan, a drug plan, an advantage plan, and we assist with all that, and then we become your broker, which means we're able to help you whenever there's problems in the future. So that's what we do, and we love doing it. Really, it's a privilege to serve people in this business. Okay, that being said, let's get into the topic tonight. And I could probably identify maybe 10 or 15 different rules that I think are critical, but we're just going to kind of highlight the top 5 and maybe a couple around those that are also important. But the first one would be, I want to make sure everyone understands that you don't have to take Medicare A or B at 65. Don't have to take Medicare A or B at 65. Now, there are some that have to take Medicare A and B at 65, but there's a group of you that do not have to, and I want to make sure you're aware of that. And so the people that don't have to go on Medicare A or B at 65 are those that are still working or their spouse is still working, and you're covered by an employer-provided plan that you like. You like the premium, you like the network, you like the coverage, you're happy with the deductible, with the co-pays, with the co-insurance, meaning financially you like that plan. You or your spouse, whoever has the plan available, are planning to continue to work for a while longer, 6 months or a year or 2 or 3 years in the future. If you like the plan and it really is a good fit, you don't have to enroll into Medicare A or B. Now, what I would suggest, if that is you today, then I still would take the time to make a comparison. Compare your group plan with your Medicare option. And that's very simple to do. The first thing is to look at the premium. What's it cost you to be on that group plan? Now, my kind of general rule of thumb is if you're on a group plan that costs you, just yourself, $250 a month or less, and it is a good group plan, meaning you're happy with the network coverage, you have a low deductible, you have a reasonable max out of pocket, and you're happy with the plan, and it's cost you $250 or less, then that's probably a good position to be in. Now, if you're paying more than that by yourself, then to me, that's probably too much. It's not a real good value if you're above $250. Now, if you're paying above $250 because you have a spouse covered or children covered, well, that's a whole different story. We never advise people to get off of a group plan, even if they're not real happy with it, if that move off of, to Medicare, off a group plan, is going to affect a spouse that's younger, that's covered by the plan, or children that are 26, up to 26 36, they can be covered by your employer plan. So we would never advise someone to move to Medicare if that move is going to impact someone else in the family adversely. So we always bring that into the equation. Now, as we talk about staying on a group plan, if your spouse is on the plan and you're both eligible for Medicare, there's two things you have to know about the premium. I want to know the employee-only price and the employee plus spouse price. Not long ago, I had a lady that was covered by a plan, husband retired, already on her plan, and both turning 65. She's going to keep working. And so I asked her, what's the premium for you by yourself, employee-only price, and what's employee plus spouse price? Well, employee-only was $100 a month. Employee plus spouse was $500 a month. So it cost her $400 a month to cover her husband on a group plan. That's too much. And so I suggested and advised them for her, stay on the group plan. $100 a month, that's great, but it's too much for Medicare. So I advised him to go ahead and go on Medicare and for her to stay on the employer-provided plan. So that is rule number one. Now, kind of a sub-point of this, let me just clarify. Tonight, there are actually 5 groups of people that have to go on Medicare at 65. You must. You have no other option. Number one, you or your spouse no longer working. You should start Medicare at 65 on your 65th birth month. If you or your spouse have no employer option available, we're going on Medicare. And the second group would be anyone that's on COBRA. And this really brings me now to rule number 2. And that is this. If you are approaching 65, and are covered by COBRA insurance. COBRA is just an extension of a previous employer-provided plan, and COBRA sometimes lasts 18 months, sometimes it lasts 36 months. And so if you're on COBRA, you're turning 65, rule number 2 is you must go on Medicare A and B at 65 because your COBRA provider is going to move to the second payer position. Now, normally, COBRA is too costly anyways, but sometimes COBRA is actually paid for by the employer, your previous employer. And if that's the case, then it's all right to keep that COBRA for a while, no more than 6 months. I'll teach you that in a minute. But if you do keep it, it's fine. But you have to enroll in A and B because if you have a claim, a health claim from 65 on, Medicare will pay first, COBRA pays second. So if you don't enroll in Medicare A and B and you have COBRA, you become the first payer. And I've seen people do that to the tune of $80,000, $100,000. Mistake. So point is, rule number 2, if you're on COBRA and you're going to keep it for a while and you're approaching 65 and enroll in Medicare A and B, Medicare pays first and that COBRA plan is going to pay second. All right, now those of you that could be retired military and you're on TRICARE, the same rule applies. TRICARE only pays second once you're Medicare eligible. You must enroll in A and B, put them in the first payer, and then that TRICARE is going to pay in second. The next group would be anyone that's covered by a small employer plan. Medicare defines that with 20 employees or less. The large group that I said you don't have to go on Medicare is 20 or more people on the payroll. You don't have to do anything with A or B, but if you're employed by someone that has 19 or fewer employees on the payroll, you or your spouse, and you're covered by that group plan, 19 or fewer employees on the payroll, you must enroll in A and B at 65 because, again, that insurance company at work is going to move to the second payer position. And if you don't enroll into A and B at 65 and you have a small group and you have a large claim, I can guarantee you'll quickly find out that they are only going to pay second because that's all they have to do. Even if you didn't know the rules, ignorance of the law, it will be no excuse in that regard. And then the other group of people that must go on Medicare at 65 are those that are covered by an ACA plan, Affordable Care Act plan. What happens at 65? All the financial incentives, the benefits of an ACA plan go away. The tax subsidies, the cost sharing, reduced premium, all that is gone at 65. And so you should go on Medicare at 65 because you'll get no financial benefits on an ACA plan. You'll pay way, way too much in premium and deductible. And so you're going to get off of an ACA plan at 65. All right, so do you have to get off if you or your spouse still working, covered by a large group plan, 20 or more? No, you can stay on that plan. It is fine to do so. That was rule number 1. Rule number 2, if you're on COBRA, you're going to be sure to go on A and B, just like you would with TRICARE or a small group plan. Why? Because they move to the second payer position. All right, and so I'm going to talk about rule number 3. And they're all important, folks, but this is critical. And I see a lot of people mess this up. If you decide that you are going to start Medicare at 65, whether you had to or you're just choosing to do so, then you want to make sure that you do not miss a once-in-a-lifetime opportunity called the Medigap OEP. OEP stands for Open Enrollment Period. So that we're talking about Medicare Supplemental Plans Open Enrollment Period. And in 45 states in the District of Columbia, what that rule means is you have this once-in-a-lifetime opportunity to buy a Medigap policy, any company, any plan that you choose. And during this Medigap OEP period, there is no underwriting involved. The insurance company must approve your application. They must cover all your pre-existing conditions, and they can't charge you any extra because you do have pre-existing conditions. And so this once-in-a-lifetime opportunity lasts only 6 months, and the 6 months, that date that it's tied to is the Medicare B date, the B date. Well, why does that matter? Well, because sometimes people enroll into Medicare A only at 65, and they work 2 more years, and they pick Medicare B up at 67. And so they have not lost this opportunity because they enrolled into Medicare A. What happens is this open enrollment period begins to become important around the B date. So the B date, where I can get this policy with no underwriting, they'll cover my pre-existing condition, all of those, tied to the B date. And so what happens, I actually can apply for a Medigap policy anywhere from 3 to 6 months in advance of my B starting. Now, the supplemental plan is not going to start until the B goes effective, but you don't have to wait for the B to start to apply. Most people do it 3 to 6 months in advance. Most states allow 6, some just allow 3. But my point is we can apply for it in advance, and then once my B goes into effect, my supplemental plan also goes into effect at the same date. But if I missed that, I still have no problem for the next 6 months because I'm still in my Medigap OEP, this Medicare Supplemental Plan, once-in-a-lifetime opportunity for 6 months of my B date. So let's say my B date is coming up, Saturday's March 1st, and that's my B date. So I could have applied in the last 3 to 6 months for my supplemental plan to go into effect 3/1. But if I didn't, if my B date's 3/1 of 2025, I have 6 months. And we would count those months, including our first month, which would be March, April, May, June, July, August. So all the way up until the last day of August, I am still in that window where I can apply for a Medigap policy that I choose, any company, any letter, and that company will approve and issue that policy, no health questions asked whatsoever. But after that 6-month OEP is over, that window is gone. Now, in all but, again, 5 states, so the 5 states where this rule is an exception is New York, Connecticut, Vermont, Maine, and Massachusetts. Everywhere else, after that 6-month window is now over, in order for you to get a Medigap policy in the future, now you're going to have to medically qualify. You have to go through underwriting. The company does not have to take you. They do not have to agree and approve of your pre-existing conditions. And so there's health conditions or medications that you may be taking. The company says, no, we're not comfortable with this, and they have every right to deny that application. So rule number 3, don't miss the Medigap OEP. And again, it's not tied to 65 unless you start B at 65. It's tied to the exact B date whenever you pick that up. All right, so that's a very important period of time as well. Now, I want to talk about the rule number 4, and that's for those of you who I addressed earlier, and that is I said you did not have to start Medicare at 65 because you or your spouse still working, covered by an employer-provided plan, 20 or more people on the payroll, not on the plan, but on the payroll, and you like the plan, the coverage, the cost, you're happy with the plan, and you're going to keep that plan. It is fine to do that. And so what happens, though, sometimes people decide, though, that they're going to enroll into Medicare A only. And they enroll in A only. By the way, many times it's fine to do A only, with one exception, rule number 4, and that is if you are contributing to a health savings account, HSA, not flexible spending, not health reimbursement, HSAs. If you enroll into A only, you can no longer put any new money into your HSA. The money that's theirs is yours, but you can't continue to fund it. So what I would do if I plan to keep working, or my spouse is, and we want to contribute to an HSA, don't do A, don't do B. And I promise you, you'll not be penalized as long as your Medicare Part A premium will be 0 cost to you. which is 99% of you. Once we have established 10 years of work, 40 quarters they call it, we'll get premium-free Medicare A, and as long as you have premium-free Medicare A, you'll never be penalized when you enroll into it. Okay, so you can't enroll late. You pick it up whenever you want to. And so my point is, if you have an HSA, don't do A, don't do B, and as long as Medicare A only is at no cost to you, you'll never be penalized. And so many people enroll into A because they feel like they're going to make a mistake and they'll be penalized. And that error, really misinformation, is repeated, and people hear that and they act upon it. And so I would much rather, if I have an HSA, do nothing with Medicare A or B and continue to contribute to that HSA, because that's pre-tax money. And if you spend it on qualified medical expenses, it's tax exempt forever, tax free. And so it's a wonderful, it's like a healthcare IRA. So keep putting money into that HSA and don't do anything with A or B. All right, now lastly, rule number 5 would be those of you that decide not starting Medicare at 65, don't have to. Spouse or I, one of us, we have a good group plan, 20 or more. And so if you decide to enroll into A only, which is fine, as long as you don't have an HSA. In the future, though, you're going to want to pick up Medicare B. And here's the rule number 5, and the last one I'm going to share, and that is this. You want no gaps in employment or insurance of active employment all the way up until when you retire. No gaps at all. Meaning if you decide to retire at 67 and you have nothing or you have A only, we're going to have to verify that you've had credible insurance coverage and employment back to 65. Could have been your spouse, could have been you, doesn't matter, but I go all the way back to 65 with no missing months whatsoever, not even one. And so where people get into problems is they don't start Medicare at 65 because they or their spouse are working, and let's say they turn 67 or so and they get a new job and they're going to make a transition, and maybe they're going to be without without any insurance for a month or two. Because remember, COBRA does not qualify as credible. So meaning they're not going to have an employer-provided plan a month or two. And so a lot of times they just wait or say, I've got COBRA. And then they go on a group plan and they retire at age 70. And we got to go all the way back to 65 and prove that they had employer coverage, someone was actually working, and we had no gaps in coverage. So if they went in transition without insurance, even COBRA, you will not qualify to come into Medicare using what we call the special enrollment period. So rule number 5, we want no gaps in employment or employer-provided coverage. If you don't start Medicare at 65, it's fine, but just be sure we have no gaps at all. I've had people that were missing 1 month in transition, and they were not able to enroll in Medicare using an SCP. They had to come in during what's called the general enrollment period. We don't want to use that one. It's limited in time, and there's also penalties. All right, and so that's rule number 5. It's fine not to start Medicare at 65 and come in later, just no gaps in coverage whatsoever. All right, okay, I'm going to stop there. I know that's a lot, but if you have other questions around the topic we selected tonight or anything else, I'm ready to take questions. All right, well, okay. Can you tell me if Tennessee will ever become a birthday rule state? Well, I don't know. That is definitely going to be up to the state insurance commissioner and, of course, the legislative body as well. But right now it's not. There have been a handful of states that have been proposed to be birthday rule states. Now, some of you that are watching say, what does this mean? What this means is that in some states, and right now there's about 12 of them. There's a couple more that are adding in 2025. But a birthday rule state says that you must, first of all, be in a Medigap policy. So that's rule number 1. You have to own this Medigap policy. And if you happen to be in a birthday rule state, what the state insurance commissioner has mandated, and this mandate is upon all Medicare supplemental plans, is that the insurance companies, if you, let's say you have a premium increase that's, crazy high, then you have the right around your birthday. Some states it's from birthday for the next 60 days. Some states it's 30 days before birthday, 30 days after. But we have this window of time where we can change Medicare supplemental companies. and sometimes plans. So you can move from like a G plan to a G plan, or sometimes a G plan to an N plan, and you can change insurance carriers to get a better rate. And during this birthday time, there's no underwriting required. But remember, folks, it's not to buy a new one. It means you already have one, and around your birthday, you're going to move to another carrier or maybe a different plan. Like, for instance, the state of Illinois has a birthday rule, but you can only exercise that rule from age 65 to 75. And you have to change. You have to stay with the same carrier. You can just simply get a new plan. Many of the states allow you to go to any carrier and to select a plan that is like to like or like to less. You couldn't move from an N plan to a G plan in most states. You can move to a G to an N because it's less benefit. And so there are, like I said, several birthday rule states: California, Oregon, Washington, Idaho, state of Nevada, Oklahoma, Missouri is called anniversary rule, kind of the same concept. Illinois, Louisiana, Maryland, Kentucky. Those are several of the ones that are the birthday rule states, and there's a few new ones that are coming on where there's things up for legislation right now to see if they're going to pass or not. But that's what that means. So you have to have a policy, live in a state where that's allowable. All right, so I can't tell you about Tennessee, but I felt a great opportunity to educate everyone about how that works. All right, Daniel. Okay, regarding President Trump, what do you think will happen to Medicare and Social Security? Should we be worried? Well, at this point in time, I definitely would not be worried. And I'm not on Social Security yet. I'm old enough. I'm 64. And so I don't think really we have anything to worry. In fact, he has talked about the possibility of not making Social Security benefits subject to federal taxes. They have been since 1983. And so he's talking about that. So that actually would be an improvement for people's Social Security benefits, because no longer we have to pay income taxes on those benefits. And no one pays full income taxes on Social Security benefits anyways, but some pay up to 85% of their Social Security income is subject to taxes. And so if he eliminates that, that would be a great thing. So I'm personally not worried about that whatsoever. And really, when it comes to the Social Security, I'm thrilled that what they're trying to do is trying to find all the waste and all the fraud and the abuse. I don't think they're really trying to take it away from you and I. I think what they're trying to do is to take it away from those people who shouldn't be getting it. I mean, you've heard some of the stories, people that are, 120 and still receiving Social Security benefits, they're long dead. And so that kind of thing is being exposed, and I'm glad they're going to clean up the rolls of Social Security, but I just don't see them doing that. Now, as far as Medicare is concerned, I think a lot of the talk about that is primarily hype. News organizations have to talk about things that are newsworthy. They try to stir people up so you'll listen. And so right now, I've not seen anything at all in regards to Medicare changes that are alarming. It's just too early to tell that. Mr. Kennedy just got appointed as the lead of HHS. Dr. Oz is the one, of course, he's put up for Medicare, and I think that's supposed to go through sometime here in March. And so I think we'll get an indication as to his view about plans. But I'm not worried. I'm not. Medicare, the biggest problem, frankly, is the fraud, waste, and abuse of people within the Medicare system, and then also the overpayments to Medicare Advantage plans. I think hopefully they'll crack down on that and make these Medicare Advantage plans pay back the money that they basically have stolen, in my opinion, from the government by miscoding and making people appear sicker than they were so they get more money. I think that's terrible. And the government's had lots of lawsuits against them, but these insurance companies lobby up and lawyer up, and then the government folds, and they don't do anything about it. So to me, that's very sad. And again, I'm not bad-mouthing Advantage companies as a whole. I'm just saying to you that abuse has been going on now for years, and I hope they clean that up as well. All right, so we'll wait and see. And for our clients, we'll stay abreast, and we'll let you know what's going on. Oh, sorry about that. All right. All right, I appealed my IRMAA, got it reduced in 2024, got a refund for what I paid in 2024. However, I'm still being charged in IRMAA 2205. Yes, you do. By the way, for those of you that are not familiar with this, an IRMAA is an acronym that stands for Income-Related Monthly Adjustment Amount. Income-Related Monthly Adjustment Amount. And so what Medicare does is they establish our Part B premium, based upon our modified adjusted gross income from 2 years prior. So if I'm on Medicare this year, 2025, they're looking at my modified adjusted gross income in 2023. But if I retire or there's a death or a divorce or marriage that would change my income downward, then I can appeal my IRMAAs. But to answer your question, William, yeah, you have to do that again. I know the form it almost implies as though you can put 2 different years on there, but never do that. Just put 1 year on there and then appeal 2 times. So if you're getting charged now, just fill out the SS-44 again, and if that life-changing event has been in the last 2 years, then you can appeal again and you'll win that again. So it's an annual event, so just make another appeal and you should be fine. Okay? All right, let's keep going, Daniel. Okay, I'm on Medicare, Plan G. I may be going back to work full-time with an opportunity for an employer plan. How will this affect my Medicare? Well, let me tell you what I would do, Matthew. Number one, let's find out first off about that employer-provided plan. What's it going to cost you? And again, you're going to think about your spouse and if any kids are on the plan, but let's look at first the cost of that. And if that's going to be substantially better than Medicare, what I would do is I would go ahead and get off everything. Now, you can't get out of A. You've already enrolled in A only, so you're going to keep that. But you can drop the B. You can drop a supplemental plan G, and you can drop the drug plan that you have, no problem at all. And so I would drop the B specifically because if your employer is 20 or more, and by the way, let me say this, Matthew, if your employer is 19 or less, you're not going to do this, okay? 19 or less people on the payroll, you're not going to do what I'm going to suggest. So I'm assuming it's 20 or more. 20 or more, drop B, drop the drug plan. And so the way you drop Part B is you fill a form out called the 1763. You can download that. It's very simple to do. And turn that into your local Social Security office. And once the employer plan kicks in, let's say employer plan starts June 1, then you're going to tell them you want to drop your Part B May 31st. And the reason is because you're going back to work. And it's fine. And like I said in the introduction, so as long as you keep that employer-provided plan with no gaps in coverage, when you retire, then you can come back in and you can pick up B using the special enrollment period. All right, so that's what I would do. Now, let's suppose that your group plan is not favorable. The price isn't as good as Medicare. Then just stay on Medicare and decline the employer-provided plan. I've had plenty of people in my career who were in that position where Medicare was better than the employer plan. What they did as they negotiated salary, they would say, hey, I have my own insurance. I don't need a company plan. And sometimes they'll give you another $500 a month or $1,000 a month because you have your own insurance. So you may be able to negotiate that. And I know some companies won't, but some will. So that's my advice to you. I think it's the reason I'm telling you to drop B is because if you're with a large group, remember that large group pays first. Medicare B pays second, and you got to pay $185 at least $185 a month for that for Medicare to be in the second payer position. I like A in the second position because it's zero premium, but I don't like B if I got to pay $185 a month. So drop that and pick it up later as long as you have continuous coverage through a group plan. All right, I hope that helped. Let's keep going, Daniel.
Yeah, this is similar but slightly different.
A little different. Okay, I will turn 65 the next couple of weeks. Looking for a job. I get a job then. Will I not sign up for Medicare because I have employer plan? Can I wait to see if I first get a job? No, I would not do that, Mohan. Let me tell you why. What I would do is this. You see here in a couple of weeks. So what I would do is go ahead and enroll into Medicare A and B now. And I'm going to tell you why. Because even if you have an ACA plan right now, that ACA plan, all the financial incentives are gone, okay? So I would suggest enroll into A and B. So you say here in a couple of weeks, I'm assuming that's going to be your birthday's in March. So I would roll in A and B right now for March. And you don't have to, immediately get a supplemental plan or a drug plan or anything. I think you're fine with that if you feel like you've got a good prospect for a job, okay? But let's say you do get a job. And what can happen then, if that employer plan is a good plan, then you can always drop the Medicare B. So go ahead and ask it to begin 3/1 of 2025. You can do that up till tomorrow. You can. You can go online if you have an myssa.gov account, and they'll start you March 1. So if you get a job over the next month or two, then if we like the package that the employer's offering, then you can drop your Medicare Part B. Again, in your situation, because you'll be getting a brand new Medicare card, you don't even have to fill a form out. You actually can turn the Medicare card over, and they give you the option to opt out of B. Okay, and so really the only risk here is minimal, and that is that since I'm telling you to enroll in A and B, you're not going to be able to contribute to an HSA. And again, a lot of people don't have those anyway, so that's the only risk involved. By doing what I'm suggesting, no HSA now. But the benefit is if you have a heart attack March 15th and you have nothing and you're waiting, you're stuck. You just are. And so I'm just saying you want to go ahead and do an A and B. And then if, let's say you don't get a job within the next couple of months and anything doesn't look promising, then what I would do, I would add a supplemental plan and a drug plan a little bit later. So let's say your birthday is in March. So you have all of April, all of May, and really all of June to enroll into a drug plan for a July 1 start date. And then you also have even 6 months of your B date to get a Medigap policy with no underwriting. Okay, so you really have a little bit more time there. But remember, if you have A and B, you're still responsible for those financial gaps. So if I were you, I wouldn't roll the dice any more than a couple of months on the drug plan and on the supplemental plan. I think you're fine, maybe April, May, and then probably by June at the latest, so you don't have secured a good job, I'd be getting the drug plan and the supplemental plan or enroll into Advantage plan at that time. Okay, so you're fine, but get A and B right now, please. All right, let's keep going. All right, to retire military, 63 years old. My health care is through the VA. How does the VA work into Medicare when I turn 65? Okay, well, first off, Mike, if you are retired military, that tells me that you actually have TRICARE insurance, TRICARE. And VA would be for someone that has served in the military and they have VA benefits. So you also have TRICARE. And so that's awesome insurance. And so what's going to happen at 65 is your TRICARE is going to automatically convert to TRICARE for life. But what happens with TRICARE for life is it will only pay second to Medicare. So at 65, you're going to have to take Medicare A and B. If you're on Social Security, you'll be automatically enrolled anyways. But if you're not, you'll have to start A and B at 65. They pay first. Your TRICARE will pay second. It's awesome insurance. It pretty much picks up everything Medicare does not cover. Medicare pays first. They pay second. It also will include a drug plan as well. So you're setting very well, Mike, and we appreciate you serving our country as well. That's why they gave you that benefit. I'm glad that you have it. All right, next. Okay, will Medicare continue to cover me if I move abroad? No. In fact, Medicare only covers us while we're in the 50 states or U.S. territories. So if you move to Puerto Rico or Guam, Virgin Islands, America, Samoa, those territories, yes. But if you're outside the 50 states, U.S. territories, there's no coverage by Medicare whatsoever. And so if you move abroad permanently, what my understanding is, and you want to clarify this because I've been in Medicare business 16 years, so I'm pretty familiar with things, but I would say this is probably kind of my weak areas, and that is this. If you move abroad, I do think that if you're able to get some type of a public health insurance plan in the country that you move to, I think they would allow you then, if you do move back to America, to go ahead and pick up B at that time. So you want to have A only for sure. Get that, the hospital side. But I don't think you have to take B if there's a public health insurance system abroad that you can enroll in, and make sure you have proof of that. If you come back to the country, you have to prove that you recover overseas. But again, I think that's the way it works. If you want to call a Social Security office, they could verify that for you as well. All right, let's keep going. All right, Plan D. Do I list all the medications I take currently when I sign up for Part D, even though I won't reach the 2,000 because I get them all cheaper with GoodRx and through Canada? Okay. All right. Here's the way it works. It's not whether you list them or not. I could write a drug plan for someone and they didn't tell me about any meds that they took. Now, I like to know the meds they're taking so we can match that drug plan up, okay? But even if you didn't use the plan to get your medications and you use GoodRx or even Canada, if that medication is in the formulary, then that $2,000 still applies if you use the plan to get the med. It's not that $2,000 cap. They're not going to credit it those you paid cash, GoodRx, those you got through Canada. But as long as it's in formulary, and if it's real expensive, then you could start using the plan, and then you would cap out at $2,000. All right. And so as far as listing the medications, we get that to make sure that your meds are in formulary. Where you get them doesn't matter at all. But if you found yourself in the position where you now needed an expensive medication, you are going to use that plan. And as long as that medication in the formulary, that's when the $2,000 out of your pocket is going to kick in. And so I'm not trying to be confusing. Let me clarify one more thing. So when we talk about the $2,000 cap, it is meds that we've ran through the plan and that were in the formulary. So if you get a medication that's $500, you get it from Canada, that's not going to be applied to the 2,000 cap. But if you ended up starting to use the plan, then you would still have to spend $2,000, and then you would be 100% coverage after that. All right, so 2 ways to answer that. I'm going to keep going. Let's go, Daniel. Hopefully that was not too confusing. All righty, here we go. Should an individual drop high deductible company insurance and switch to regular coverage if they begin collecting Social Security at full retirement age? Well, okay. Not necessarily. It just depends on how high the deductible is and if you're comfortable with that kind of risk. And now keep in mind, when you start taking your Social Security, if you make your own application, you're going to be given the option to take B or not. So you actually, on the Social Security application, can say no to B. Why? Because if you're covered by a group plan at work, 20 employees or more on the payroll, you don't have to take B. And so if you're happy with a high deductible plan at work, it's fine. And then what would happen, you have Social Security and you have A only with Medicare. So then when you get ready to retire, as long as we've had continuous coverage, then we can pick up B at a later date and then decide then to get a supplemental plan or advantage plan at that time. So you could go either way. But my view is if you're healthy, you're happy with the plan, and you're comfortable with whatever the deductible would be, knowing you're going to have to spend that if you would have to, it's fine to stay where you are as long as there are 20 or more employees on the payroll. Take Social Security and A only. All right, next. Okay, what if you retire at, say, 66, 9 months old when you're still employed and covered by their plan? How much time to apply to Medicare without missing a month's coverage or being penalized? Okay, so, okay. Still employed, covered by their plan. Okay, well, here, let me say it this way. Let's say that you were eligible for Medicare. Clearly, in this scenario you are. And you called me tonight or tomorrow. And you said, hey, I want to start my Medicare on 3/1 of 2025. Tomorrow is a business day. And as long as we can enroll everything online, which is almost the way we can do it always, meaning you have a myssa.gov account, I could enroll you tonight, I can enroll you tomorrow into Medicare A and B, and your coverage would start 3/1. It can be the last day of the month as long as it's a business day, and we want that submitted before 4 p.m. Your local time, and then your coverage will begin 3/1. Now, will you have your insurance cards in hand? No, but if you had a heart attack on 3/1, you were covered by Medicare, you're covered by your drug plan, you're covered by your supplemental plan, advantage plan. I mean, really anything you pick. We could do that quickly. All right, so again, it doesn't have to be done way in advance. Now, I have done that a few times, by the way, but the norm is when people set the retirement date, they notify us anywhere from 30 to maybe 90 days. No, I wouldn't do it 4 months, 5 months. That's not going to happen. So within about 30 to 90 days in advance of your retirement, that's when you want to kind of get the ball rolling to set up all your Medicare insurance. Okay. So, but it can be done last minute if it came down to that. So don't worry about that. I just worked with a guy last week. That's what he was worried about. He thought maybe lose his job, and so we got everything rolling, and we're going to start his Medicare 4/1. We truly could have started 3/1, but he hadn't been laid off yet, so he went ahead and we went for a 4/1 start date. All right, so it can be done very quickly. It just can be. Okay. Again, I like you to have cards in hand, but even if you don't, we know we have coverage. All right, let's go. Okay. All right, William. So is Medicare Part A and B drug formulary the same as on Advantage plans, or can Advantage plans pick and choose their own Part B formularies? Okay, no. When we have a medication that is covered by A or B, that is a professionally administered medications. So it's really not about a formulary with A and B, William. It's not. It is a medication that Medicare will cover while you're in the hospital or because of an outpatient situation, chemotherapy, or pain meds after knee replacement or something, and so or at the facility. So remember, A and B will cover medications, but it's professionally administered medications. For medications that are covered, that I self-administer, those are covered by drug plans. Those have a formulary. And so what happens is the Advantage company can determine their own formulary within their embedded drug plan. Yes, they can do that, and that will vary company to company. When someone gets a supplemental plan, they're going to buy a standalone drug plan that, again, is going to have its own Part D formulary. All right, so A and B are professional meds. Part D, whether embedded in Advantage or separate with the sup, that will vary plan to plan for sure. They can decide that. All right, let's keep going. What happens if your Medigap provider goes under? All right, well, number one, I've been in the business 16 years. I've never seen it. I'm not saying it couldn't happen. All right, so I tell you what I have seen. I have seen carriers that will pull away from a market or just totally get out of the med sup market. But I've never had a client ever hurt by that because it is a guaranteed renewable for life policy. So when that insurance company writes that policy, even if they decide to stop writing policies in the future around the country or in a certain region, they still will honor that policy, cover you on that policy. You're not going to lose that policy as long as you pay the premium. It is yours for life, guaranteed renewable. Now, let's suppose what happened. Let's say your scenario did happen. A company went under. Here's the way it works in every state in the country. When an insurance company applies to do business in the state, what they have to agree to is to cover other insurance carriers if they were to go out of business. And I think they pay into a fund for this. So if your med sub company did go under, you'd be given a window of time, I think it'd probably be 60 days, where you could move from ABC insurance company that just went under, you had a G plan or an N plan, and then all the other carriers that offer plans in that state have to give you a policy, not give, but sell you a policy, with no underwriting at all during that window. Like I said, it'd probably be 60 days. And so you can move from the bankrupt carrier to another carrier of your choice, and they will cover you with no underwriting whatsoever. Now, the premium may be different just because you're 2 years older, 3 or 4 years older or something, but you continue on with that coverage, and those carriers have to take you. They agree to do that whenever they do business in any state. All right, if I call your office to be a client, should I cancel my phone appointment with Social Security? In other words, do you do everything? Yes, we do. Now, let me explain something. We do everything when we're tying in the Medicare and the Social Security together. So the answer is yes. We'll take care of it, no problem whatsoever. Now, here's the thing. If that appointment is real soon, in the next week or so, I'd probably still keep that since it's on the books. But if it's out 2 or 3, 4 weeks or whatever, and you're ready to do business with your Medicare and all the dates line up, then it'd be fine to cancel. But let me share this. Don't cancel appointment until you first call in and we've assessed and done what we call discovery. We want to understand your situation. We'll give you the advice and tell you exactly what to do and even do it for you. But have that call first and then cancel the appointment if the agent that you talk with advises you to do that. We do it all, but let's make sure timing is right before you cancel that appointment with the Social Security office. All right, next. Okay, the problem is I applied through your office and Social Security sent a letter saying I said I was not a U.S. citizen. Okay, there is a block, like when we're doing an application, it says, are you a U.S. citizen born in the U.S., U.S. citizen born outside the U.S., or a non-U.S. citizen? Okay, so I'm not sure what was checked on that box. If you are not a U.S. citizen, if you have your paperwork, then that also has to be submitted to the local Social Security office. So I have to know a little bit more. But I tell you what I want you to do. I want you to call the office and so you apply, send a letter. First off, I would love to see that letter that you're getting for sure. I'm trying to tell you what I want you to do. I'll tell you what I want you to do. I want you to call the 800 numbers on the screen there, and I want you to ask for Sherry Larson. Sherry Larson. And Sherry is on our customer service team, very experienced, real knowledgeable. and tell her your scenario, tell her what's going on, and that Marvin said during the live event that I would get involved. So you can give her your name and give me a chance to kind of look up to see what's going on, and then we'll tell you what the next step is. So again, call in. Sherry, I think we're open 7 to 7, Monday to Thursday, 7 to 6 on Friday. And I think Sherry, she's comes in the morning. So anyway, call in and talk to Sherry and tell her what I just told you, and then tell her to reach out to me, and I'll probably contact you and tell you exactly what I would do. I just need to know more. I don't want to speculate as to what happened. It could have been an application issue. I'm just not sure. So give us a chance to get that corrected for you. We're happy to do that. All right, who's next? What about if you're self-employed, reaching 65, can you apply for Medicare? Absolutely. In fact, now, if you own your own company and there's 20 or more on the payroll, then if you have a good group plan, you don't have to do anything. But if you're self-employed and it's just you or a few employees, then you definitely want to go on Medicare A and B at 65. Okay, now, again, you may not be on Social Security, but as long as you've paid into the Medicare tax system for at least 40 quarters, which is 10 years, then you're eligible for Medicare at 65 because you've been paying self-employment taxes. You know, people who work for someone pay FICA taxes, the Federal Insurance Contribution Act, but you are doing as well. You're paying the full amount. So 10 years worth of work, you're eligible for Medicare at 65, and I would enroll, 2-3 months in advance of turning 65. And by the way, Carmen, if you want us to help you with that, call in. We enroll people into Medicare all day long, every day. So call in and tell our agent that's what you want help with, and we'll do that, and we'll talk about your other insurance decisions as well. All right, as I understand it, for 2025 IRMAA, it's $212 for couples. What is for 2026? When will it be announced? Okay, yeah, we won't know that until probably, it could be what, Daniel, November, December. It always comes out late in the year, so I have no idea. But listen, it's probably going to go up like it normally does, $3,000-$4,000 on the married side. I think last year, we're $212 now. What were we at last year? 209, 206, 209. Okay, 206. So it went up 6. That's right, because the individual went up 3. Yeah, that's right. So it went up 3,000 for the individual, 6,000 for the couple. So I would expect something very similar increase next year. So it's 212 now. So probably maybe 218 range, and then they'll be looking back, of course, at 2024 when we go on Medicare in 2026. All right, at what age should we be calling you to discuss our individual situation? Well, we like to start helping people right about 64 and a half. You're welcome to call in earlier, but some things can change, and so 64 and a half is really ideal. You can call in, set an appointment, talk to an agent live if you want to as well, so that's about right. Okay, Helen, on another webinar, they say even if you're working and have insurance coverage at 65, you still must apply for Medicare, but can waive or delay coverage. Is this accurate? Okay, well, I think what they're saying is that, number one, as long as you paid, I don't know what they're saying, let me tell you the accurate, okay? As long as you paid into the Medicare tax system for 40 quarters, 10 years worth of work, that's your work record, a spouse, or even an ex-spouse, as long as you paid in, if you're going to continue to work and you have a group plan that has 20 employees on the payroll or more, you don't have to do A, you don't have to do B, nothing, A or B, nor do you even have to notify them that you've chosen not to do anything, okay? And so not A, not B. Now, a lot of people, even people in my business who don't really know what they're doing, will tell you that you still have to roll into A only, even if you don't take B, because you're going to continue to work. And that's not true either, okay? And so when you're saying that you must apply for Medicare, it's not true. Now, if you're not working or you don't have a group plan of 20 or more, you're meaning 19 or less, if you are working, then yes, you're going to take Medicare A and B. All right, so it's not about applying and then waiving and delaying coverage. It just doesn't work that way. Now, if you're on Social Security, you'll be automatically enrolled in A and B. If you have a good group plan that's reasonably priced, then I would delay taking B, and then you would actually disenroll for Medicare B. But I don't think that's what you're asking me. Am I tracking with her question, Daniel?
I think so.
Okay, yeah. Even if you're working, have insurance coverage at 65, you still must apply. That's not true. No, at all. You don't have to apply. Now, listen, if you don't have an HSA, I would take A only. It's fine. Now, you're in a big group, A pays second, doesn't pay copay, doesn't pay deductible, but it will pay coinsurance. So I like people getting A only at 65, even if they keep working, unless they have an HSA. So it's not about enrolling and then waiving it. It doesn't work that way. You're just talking to people who know what they're talking about. Call in and talk to one of our agents, please, Helen, and we'll give you accurate advice, show you what to do so you have no doubts whatsoever. You don't need to be worried about this. Call in and we'll help you. All right. How is Medicare affected when you move out of your state? Should I relocate to the state I want to retire before applying to Medicare at 65? If so, how far? Okay, here's the way it works. Regardless of where you live, the Medicare A and B is going to be the same. So that's a non-issue, all right? And so when it comes to Medicare supplemental plans, there are some states that have a higher premium than others. That's for sure. And it's not usually huge differences, but it can be. Some states have what we call community-rated Medicare supplemental plans. Community-rated is kind of high. There's a few states that have that. The majority of states are going to be attained age or issue age policies, and their premium is much more reasonable. And so if what I would do, call in and let's find out the rates where you are now and the rates where you may move to, kind of find out where that is. Now, if I have people that are in transition and they have residence in 2 states, we will ask them then, when you get ready to retire soon, which state are you going to be in? And if the state that they're moving to is going to be lower, then that's where we actually would write that Medicare supplemental policy. Now, the mail's going to go there, you're going to get all your stuff there, but if you're moving there soon anyways, it's fine to do that, as long as you have a legitimate address there. So that's kind of the way that I would look at that. As far as relocating, let's say you live, I'll just say you live in Ohio right now, and you live in Ohio and you're thinking about moving to Tennessee. But you're going to be in Ohio for a few months, maybe 6 months or whatever. Go ahead and get a Medigap policy in Ohio, get it set up, and then when you move to Tennessee, you're going to do a change of address. Medicare's going to know about that, and then you're going to get re-rated in Tennessee. The rate may go down a little bit, could go up a little bit. In my example, probably go down a little bit. I think Tennessee's a little cheaper than Ohio, but I just wouldn't make a huge deal of this. I wouldn't complicate it. Wherever you are going to be 6 months and 1 day or more, that's going to be your official residence. And then if you change that, it's no big deal. You'll change addresses. That notifies Medicare. Supplemental plan will then adjust your rate or keep it the same, whatever. It's usually minimal. And you would need to get a different drug plan when you relocate. But again, that's very easy to do as well. So don't complicate it. It really is not that hard. And again, I know I've said this a lot, but call in, Carmen, and our agent would guide you exactly what to do after they have a full understanding of your situation. All right. All right. Does your company charge a fee for assistance? And if so, no. In fact, Helen, know this. Anytime you're going to work with a broker or an agent, we are always paid by the insurance companies, not by you at all. So yeah, we truly, I know it sounds awkward, but we're truly free to you. And this really is the way all insurance works. Now, we're retirement Medicare brokers, but it's the same with your homeowner's insurance, your auto insurance. I mean, again, I don't write that, but it's the cost of doing business for the insurance company. It's the cost of generating that new business. The cost of that then is paid by the insurance company, which means they pay us a commission, not you. We're truly free to you. There's no cost. We don't work for free, but we're not paid by you. So don't worry about that. Also, while I'm talking about this, know this. If let's say that you decide that you want to go with United Healthcare, or you went with Aetna or whoever, doesn't matter, and you went with them direct or you use a broker, the premium that you pay is the same. In other words, you don't save any money by going direct to a company. You're not going to spend any more money if you use a broker. The premium cost is all the same because the insurance companies set the premium. We provide the service. And so, I mean, of course, I'm a broker, so I'm a little bit biased, but I think one of the advantages of doing business with a broker, hopefully, number one, they know what they're doing. They can give you unbiased advice. Why? Because we write for lots of carriers, lots of plans. So, we're fine with whatever is best for you. And we're paid by the insurance company. And if you're dealing with somebody legitimate, they're also going to service you. In That's one of the issues today with going direct with a carrier. Yeah, you can go direct with a carrier, do it all yourself, but you're just a number of millions. And you have a customer problem, issue. You're not going to talk to anybody that's going to frankly care about you. You're going to be in the Philippines or India or China at a call center where you're probably not going to be able to understand their English. And I doubt sometimes if they even understand Medicare, okay? And so if you're dealing with a reputable company, they're going to have their own customer service team. We do. Our clients call us. You don't have to call anyone else. Call us. When you're our client, we'll take care of you. So again, no cost whatsoever for our services. And be delighted to be your broker. Let us know. All right, next. Jonathan England. Hey, Daniel, will you do me a favor? I've got to sit down. Okay. Hey, folks, I'm just going to change positions here. I've been standing here for an hour. Been having some back problems. And so if you don't mind, I'm just going to move this over and sit down. Can I just move this way? Okay, thank you. Sorry, folks, but I'm hurting. Okay, here we go. I've taken Social Security at my full retirement age of 66 and 10 months, so you were born in 1959. Is this a good idea to help get bills paid off, especially if it eventually goes away? Okay, so first off, Jonathan, I do not think for a second that Social Security is going away. I don't think that, okay? I know the Security Trust Fund is need of, they need to get that beefed up again for sure. So I am not saying that there's no problems, but I don't hold the view it's going away. I really, really don't. Now, the trust fund, I think right now, 2032, 2034 has enough to pay 100%. And then if they don't make some changes, then it's, I think right now, about 80% on the dollar. And no one wants to see a reduction in Social Security. Neither party, Republicans, Democrats, no one wants to see that go down, okay, by 20%. So what they're going to do here soon, they're going to start making some changes. Now, what will that look like? I'm not positive, but I think they're probably going to raise the full retirement age, not for you and me, but for our kids. They're probably going to have a full retirement age of maybe 70. I don't know. But I think they'll do that. And then also what they'll do is they'll raise the max tax on Social Security. Right now, once you reach $176,100, all that income above that is not subject to Social Security taxes. Now, it's subject to Medicare taxes, but not Social Security. So I suspect that's what they're going to do. They're going to raise the max tax. So may raise that to $220,000. So those people that are high income are going to pay Social Security longer, a higher dollar amount. And so I believe that's what they'll do. But I think they're going to get it fixed. And one of the reasons I feel so strongly about this issue, listen, 40% of all people today, or approximately 40% of all people that are on Social Security, it's their only source of income. And so for them to get a 20% reduction in their monthly benefit would be painful for our economy and for our country. And so I hate it that they've kicked the can down the road so long, but I think eventually they're going to take this up and they're going to get this Social Security Trust Fund solidified again. Okay, so to answer your question, taking Social Security full time, my view is if you don't have to have the money right now, go to full retirement age. And then that way there's no reduction in benefit. If you keep working, you'd have no earnings tax. You have no earnings test. You have no earnings test. And so I like people waiting to full retirement age if they can. Now, if someone just got diagnosed with cancer, I'd take tomorrow. Okay, I'd be applying. That's a different issue. But if we have good health, we have longevity in our life, we think we're going to live to be, low 80s or so, then I think it's wise to go to full retirement age. And if you need the money, take it, no problem. But don't do it just because you think it's going away, because I just don't believe that. I do not. Okay, let's keep going. All right, I signed up for Plan A when I turned 65, but I lost the opportunity to save money, health savings, and I'm still working. Can I drop Plan A for now, sign up for A and B when I'm on a company plan? Okay, here's the way it works, Sam. Probably not. Once A has gone into effect, if there's zero premium, which is 99% of the time, you cannot disenroll from Part A. Now, if someone made a mistake and enrolled in Part A but has not gone into effect, then I think you can undo that. In all my career, working in this business, retirement planning and all, I've seen one person successfully disenroll from Part A, and that goes back a few years, and it was disaster. Disaster. So if it's already started, I don't think you're going to reverse it. I know you're disappointed that you cannot put money into a health savings account. Hey, make sure you put money into an IRA, okay? Because really, once you're past 65, the health savings account are like healthcare IRAs. And if you use those for qualified medical expenses, it's tax free, but you can still pull the money out on non-medical expenses and just pay the taxes on it. So, there's another way to do that. It's not identical. I'm not trying to say that, but make sure if you can, be putting money into an IRA, but an HSA is just not going to be possible at all. So, sorry about that. All right, Shelby, I could not pay the premium Part B 4 months into my 65th year, so Medicare canceled me. That's true, they will. Can I reapply for Part B? Will I be penalized because I could not pay? Okay, so here's the way it works. Number one, Shelby, very, very important. You have up until March 31 to enroll into Medicare Part B, okay? The way you would do that is there's a form called a CMS 40B. CMS 40B. You would submit that to your local Social Security office. Now, if you submit that tomorrow, they'll start you March 1. If you submit it in March, they'll start you April 1. Okay? And so you can reapply. Now, here's the way the penalties work, because I don't know when you had it and lost it, but for every full 12 months, when you could have had B and you didn't have B, then they assess you a 10% penalty. So it's a full 12 months. So if someone went without and they should have had it for 11 months, they're still not penalized. But once I get in at 12 months, so part of 12 months to month 23, it's a 10% penalty. So the worst case scenario, they're going to assess you this year, $185 is the premium. That's $18.50 penalty. So a little bit less than $20. But you've got to do it no later than March for an April start date. Okay. Now, as far as you having to still be billed for those previous months that you didn't have it, I don't think so, because they canceled it. So I think just moving forward, full 12 months, 10% penalty, and of course it will be a lifetime penalty. But I would be doing it real soon.
Should you consider looking at extra help? Is that something?
Yeah, that's a great idea. Hey, our producer Daniel just had a great idea, and that is when you call in, if money is really tight, apply for extra help. And if you qualify, then they can actually, meaning Medicare, Medicaid, would actually cover your Medicare Part B premium. And by the way, when people, those kind of situations, they waive all penalties as well if you have extra help. You also could get some help on the drug portion as well. So that's a very good idea. Apply for extra help, and you can do that, with Social Security office or Medicaid. All righty. Is this my next one? Okay, good. Okay, am I covered when traveling abroad by supplemental plan to original Medicare? Well, yes, with some plans. Okay, there are 10 MedSup plans, and the top 3 would be F, G, and N. Now, all people starting Medicare after 1/1/2020, the top 2 plans are G and N. But my point is F, G, and N, and 3 other plans. Anyways, there's 6 of the 10 MedSup plans that provide for you foreign travel emergency benefits, 6 of the 10, right? And I know FG and N are in that list. And what that means is if you're traveling abroad with an FG or N plan and you have any kind of medical emergency, that plan will pay up to $50,000 lifetime benefit. So it's not replenished. So if you use the full $50,000, that's it. And the way a claim works is you have a health claim, emergency outside the U.S. or the territories. You pay a $250 deductible, and then the balance of the bill is split 80% paid by the company. You pay 20%, but their 80% stops at $50,000. So to answer your question, the answer is yes, but it's limited to 6 of the 10 supplemental plans, and it's limited to a lifetime benefit of $50,000. All right, next. I will be 65 this year, retired military, have credible employer medical insurance, and plan to continue to work. Good. If I enroll in A&B, will my spouse and kids under 26 lose their coverage via my employer? No. As long as you stay actively employed your kids are on the plan, your spouse on the plan, no problem whatsoever. What I would do in that scenario, though, to me, I think that's overinsured. I think what you may be trying to do is you're saying you want to enroll in A and B, so then TRICARE will be your primary insurance. So that's fine. So the only thing that will happen is when you go to the doctor or the hospital, you use your Medicare A and B card and your TRICARE card, and then your children and your spouse can just continue to use the employer-provided plan. So it's fine to do that because you're not canceling the employer plan, you're just adding some additional benefit. Now, I also would tell you, if it were me, what I probably would do, if you have a great group plan, then I would just stay on that and don't take B. I know your TRICARE's kind of floating out there available, but if you have a great group plan, you have to decide, do you want to go ahead and pay your Part B premium? Now, if you have an average group plan or a terrible group plan, then I like your plan. I like saying, let's take A and B, let's have TRICARE, keep the employer plan in place for the benefit of your wife and your spouse and your children. So I hope that helped. That was a loaded question there, by the way. All right, I turned 65 in December. If I stop working on January 9th of 2026, I enroll in both Medicare A and B and have it start up either December 2025 or January 1, 2026 through, though we'll still have employer insurance. Okay, yes. So here's what's going to happen. If you, start up either December 20, all right, you can. So if you decide to enroll into, let me tell you what I would do. Let's say it this way. I would enroll online 3 months before you turn 65. So your birthday is December, so back of the clock, November, October, September. So anytime between September, October, November, enroll into A only. Just take A only. That way you're in the Medicare system. And then, because you're going to work on January 9th, I am assuming then that your employer is going to cover you all the way through the end of January, so you really want your B to start in February. That's what I hear you saying. And so the way to do that is we already have A and B only. We already have A only. We've enrolled in advance, so we have an A date of December 1, 2025. And then what I want you to do during the month of January, submit a form that's called a 40B. It's submitted in January. You request an effective date of 2/1 of 2026. And that way you're not wasting any money, you're not overinsured. That's the way I would set that case up. And by the way, you call in and our agent can help you do that and they'll walk you through it. So again, let's take A only. We have an A date effective 12/1/2025. Let's submit the 40B form requesting our Medicare B to start 2/1 of 2026. And that would be a perfect way to transition. All right, let's keep going. Here we go. What is the ideal coverage at 65? Well, Carrie, for me, and I'll be 65 in January. I'm 64 now, but I'll turn 65 in January. I am going to get A and B, and I'm going to get a supplemental plan. All right? That's what I'm going to do, and I'm going to tell you why. Because, number one, I can afford it. Medicare supplemental plans are not, real expensive anyways. They're going to range, most states, and please, folks, don't beat me up on this because, you're from all over the country, okay? But most G plans are going to be in the neighborhood of about $150 a month. Most N plans are going to be in the neighborhood of about $110 a month. N's are $110, G's are $150, give or take, please. That's the range. So they're not $500 a month. They're in that range. So I can afford that. And so that's what I would choose. I like supplemental plans because I like some of the features of them. I can go to any provider that takes Medicare. I love that. If I have an advantage, sure, I have a zero premium, but I have limited providers. I have to be in a network, either an HMO or a PPO network. Those change all the time. That's frustrating to people. I like supplemental plans because, number two, I have no pre-authorizations ever by the supplemental insurance company. In other words, if Medicare says they'll cover something and the doc says I need it, end of story. Insurance company never interferes. They can't delay, they can't deny. They are going to follow whatever Medicare covers. They're going to fill in the gaps. I like that feature, and I'm willing to pay $110 or $150 a month to have that. I also like the fact that supplemental plans are lifetime. I had that policy, and in the future, my health changes, I'm not going to lose my policy. I don't have to reapply or requalify, nothing. That is a lifetime policy, and it's portable. I love Florida. I live on the Missouri side. Our office is around the state line in Kansas. But I like Florida, and I hope they have some property down there. And if I move to Florida, you realize my MedSup plan in Missouri, I take it with me to Florida. It's portable. I can take it with me. I can never be canceled. And so the point is, I like the features. I like the fact that I can pay a premium, pretty well be done. If I had a G plan, I'm done. I meet a small deductible once a year, and it's over with. Now listen, if my money was such that I could not afford that $110 to $150 a month, then I would get an Advantage plan. that's really who, in my opinion, people, that's who ought to be getting Advantage plans. Those people that cannot afford it. And that's fine. Our budgets are just different. Hey, there was a time in my life I wouldn't be able to afford it either. I was a pastor 20 years and 7 kids. I'm telling you, I know what it means to live on a tight budget. So if the budget is tight, then get an Advantage plan. Don't try to get a supplemental plan if you cannot afford it, because you won't keep it. So get the very best Advantage plan that you can, in your particular market. That's the place for Advantage plans. Now, sadly, today, a lot of people get Advantage plans because of zero premium, as though they're not going to spend any money. It's not true. You won't pay a premium, but you're not going to the hospital for free. You're not going to get an outpatient surgery for free. You're not going to see a specialist for free. You're going to pay for that. And don't get an Advantage plan just because they offer you some perks. Those perks are highly advertised and highly underutilized. Why? Because they're difficult to use. Networks, a whole different kinds of things. So, Mom, I say to people all the time, look at the features of your insurance. How is your insurance going to work? So, Carrie, you're asking me what's ideal. To me, a supplemental plan is ideal. But if I can't afford it, then I'm going to get an Advantage plan. A silly illustration, but I really mean this, folks. You think about just cars. This Toyota. Toyota makes a Lexus. Toyota makes a Corolla, right? They'll both get you from A to B. They both take gas or electric, however you're getting there. Their transportation, means of transportation, but they're different. The Lexus has different features than the Corolla, okay? And so some people cannot afford the Lexus, and a Corolla's fine. It gets the job accomplished. And some people say, hey, I can afford the Lexus. I like the feature of that, so that's what I have. And it's this way with all types of vehicles. It's just the way it works. Ford makes an Expedition, and they make an Escape. Different cars, different price points. So you have to decide, what features are you looking for? Some people are just looking for cheap. Well, then go on the Advantage plan. Some people are looking for quality. They want to go to any doctor that takes Medicare. They want a permanent plan. They want no pre-authorizations. They want no interference from the insurance company. And that is going to be a supplemental plan. Yeah, you got to pay for that, but what are you getting for that? You're getting a lot, in my opinion. So that would be the ideal situation. All right, let's keep going. Hey, by the way, I want to share this with every one of you. The reason Advantage plans today are pushed so much is because, number one, insurance companies are making billions off of them. Okay, number two, because agents make a higher commission. If I cared about my commission, I would not just have rattled on with all that, because Advantage plans pay me twice as much initial commission, and I get lifetime residual income. Supplemental plans pay half, and we get paid for 6 years on those. That's it. Okay, so it's in the benefit, in the advantage, really, of the insurance agent and company for you to get an Advantage plan. Okay, it's not necessarily in your best interest, but it's definitely in their best interest. And again, that's why they're promoted so much. And by the way, those of you who have them, I'm not saying you have junk insurance or bad insurance, but I do know you have some strings attached to that if you get cancer or something happens to you, you may not be real happy with that coverage. And that's what we see. I've never had a complaint one time on a supplemental plan ever. And I could share stories for the next hours and hours about people who had problems with Advantage plans. All right, let's keep going. That's all right. We're going to get a question here, folks. Hang in there.
There it is.
Here we go. All righty. Paul here. Can I return monies from an HSA if I didn't stop HSA contributions early enough? Okay. Here's the way that would work, Paul. And by the way, you all, hey, I'm not an accountant. I am a financial advisor, so I'm pretty familiar with tax stuff. And so I think what happens, I don't think you have to return it at all. It's fine to be in there, but what you want to do is you want to have your accountant make a correction, because that money that went in pre-tax, and it should have been taxable. So you want to make that correction. So again, talk to your accountant about that. So you pay the taxes on that money. And I know when we overfund it, there can also be a penalty. So ask your accountant if the adjustments they make to your income, so you pay taxes on that, would be sufficient. And if not, they'll let you know. So again, you have a very legitimate concern. I'm not minimizing that whatsoever, but I'm not so sure you got to pull it out. I think you just pay taxes on that overfunded amount, and I think that'll take care of the problem. Okay? All right, let's keep going. Okay, with respect to $2,000 max out of pocket for Part D, how is it calculated? Is the total cost of the drug applied to the $2,000 or just the copays? No. Okay. Officially, the $2,000 is the max that you would have to spend on medications that are in the formulary that you use, that you covered through the plan. That's the 2,000 cap. So listen, great example. I had a lady recently she's on Stelara. It's I think it's an what do you call it? You have an autoimmune disease. They use that. I think it's Crohn's or maybe psoriatic arthritis, something like that. But it's very expensive. Her medication was $13,500 a month. $13,500. The plan we put her on, Stelara, is in Formulary. So the most she'll spend the whole year is $2,000. All right. So that's what it's designed to do, to make sure that people are not going broke trying to get their medications, or because they don't have the money, they don't get their meds. So that's the $2,000 cap. That's how it's calculated. Now, what does happen on some of these plans, let's say, for instance, you are on Eliquis or Xarelto. These are AFib, kind of heart, blood thinner meds. What I have seen is that if that medication retails for $600 and you're on a plan where you just have to pay a copay, then once the full cost of that medication reaches $2,000, you had no further out-of-pocket expenses. I've seen that as well. Okay, so sometimes the $2,000 is not fully out of your pocket because they counted the full retail cost of the medication even though you didn't pay it. Now, if you're on Stelara, it's going to happen. You're going to spend $2,000 out of your pocket. And so hopefully that helps. Okay, main thing is I want everyone to remember, the $2,000 applies for meds that Medicare, the Medicare Part D plan covers. Okay, if it's not in Formulary, you buy it somewhere else, not going to be covered. All right. All right, you continue to tout Medigap plans that cost around $125, $150. My Medicare account online access doesn't come close to offering that pricing or companies your online quote system does. Okay, well, Alan, only thing I can say, I don't know. I'm just telling you that's arranged. Now, keep in mind, you all, Alan, number one, I don't know how old you are. I don't know where you live. I know that if you live in New York, we're probably talking a couple $100. So that's why I said, don't get upset with me. I'm just kind of giving you an average around the country. I will tell you that's very accurate in the majority of states. There will be exceptions, especially, Alan, if you live in a state where they're community rated, because the 65-year-old pays the same thing as the 85-year-old. So what do they have to do? The 65-year-old is paying a whole lot more money than what they should have to be paying because everybody gets the same rating, community, regardless of age or regardless of gender. Okay, so that's probably where you live. I don't know for sure. But again, when I say I'm touting it, it is very accurate what I'm saying. In the majority of places, obviously there's an exception, and you live in one of those places. So I'm really sorry. Call in and let's make sure, though, sir. All right, why would I not take the lowest G plan in my area, change from provider to provider? Well, you may be able to do that, Gary, as long as you live in what we call a birthday rule state, or Missouri is called anniversary rule. Because in those states, if you live in one of those, you can move carrier to carrier with no underwriting. But in a state where there's no birthday rule, then the lowest G may be fine. But the problem is, if you have to qualify to change carriers, meaning non-birthday rule states, which is the norm, in order to change those plans, you have to go through underwriting. So if you just go with the lowest, maybe that was what we call a teaser rate. And they're just trying to collect premium dollars, pull a lot of people in, knowing they can raise those rates up. And I've seen that from time to time in my career. And so what I would rather do is I want to go with someone that's competitive for sure. But I also want to look at the history of their price increases. How stable have they been in the last 10 years? Now, none of us have a crystal ball. I can't predict what's going to happen. But we've found that if we see someone that's been pretty stable in the last 10 years, probably going to be more stable in the 10 years ahead as well. So I think history is going to probably repeat itself. So what I care about is initial premium, but also care about how assured am I that I think they're going to be stable. And we have found that carriers that are more national instead of regional tend to be more stable, and a carrier that has a greater market share in an area. It's also going to be more stable just because there's more premium dollars coming in and the risk is spread out. If I've got a block of business that has 1,000 people in it and I've got a block of business that has 25,000 people in it, I'd almost guarantee the 25,000 member block is going to be more stable, especially if we start having some cancer and other issues. So these local, regional kind of carriers, we honestly try to avoid. They may look good initially, but long term, we haven't seen them to be very stable. All right, so if you're in a birthday real estate, go with the lowest. You'll be able to move it anyways. If not, I wouldn't just look at initial premium. Look at stability of rates, sir. Okay, let's keep going. If I'm on a federal disabled person on Medicaid in Washington State, must I switch to Medicare at 65? Yes. Anyone that's on Medicaid, once you turn 65, Medicaid is going to move to the second payer position, I promise you. You have to enroll in Medicare A and B, and Medicaid pays second. Now, you could be in a financial position where the state may be willing to pay for some or all of your Medicare Part B, but it's definitely not going to pay first any longer. So you do have to take Medicare at 65. Alrighty, Tamara asks, will my retirement income affect my Medicare cost? Yes, it will. The formula for your Part B premium, that's what you're asking about, Medicare cost, because A is 0 for most people. B has a cost. And so they look at your modified adjusted gross income. That's line 11, which is your AGI, plus tax exempt interest, that's line 2A, and that becomes the number that Medicare looks at. So yes, your retirement income is going to be in your AGI, therefore it will affect how much you pay for Part B. Now, this year the number is for a single person, as long as you're below $106,000, modified adjusted gross income, married, filing a joint return below $212,000, your income's not going to be affected at all. But once we get above those thresholds, above 106 for single, above 212 for a couple, then we pay additional money for our Medicare Part B. Those are called IRMAAs. Alrighty, here we go. 65, got on Medicare 2024, was employed with insurance until November 2024. Am I still in 6-month window to get Part B without a penalty? Okay, so the way that works, so is March, April, May, June. Okay, actually, on this scenario, just so you know, you have 8 months from when that employment coverage ended, okay? So employed until November. And so, by the way, you need to be doing this ASAP, okay? Even if you have COBRA, the problem is right now, COBRA pays second, so you're not in a good position, but it's all right. What I would do if I were you, you're fine, because from the date you lost employment, officially you have 8 months to come into Medicare B, okay? But don't do that, because you're without insurance, and if you have COBRA, I don't care. COBRA's second, so you need to do this, and if I were you, I'd do it tomorrow. And if you enroll tonight, you can start your Medicare B. And so you can go online and you can enroll in Medicare B. Now, they're not going to complete the enrollment yet until they verified that you had credible insurance at work. And so you're going to have to get a form called L564. You have to get that submitted, but they'll pend your application. So go ahead and apply for it, and you can request a 3/1 start date on Part B. And again, it won't be approved, but it'll go pending until you get that L564 from your employer. And by the way, serious, listen, we will help you with this. Call in and let us walk you through this whole process. We'll do the L564, the 40B. We'll tell you exactly how to do it and when to do it. But you can still do this tomorrow. No problem at all. And then so that'll allow you to start your Part B. And then from that Part B date that's when the 6-month window comes into play with a Medigap policy. I mean, I wouldn't wait 6 months, but you're still fine either way. So we're talking about 2 items here. Starting Medicare B, you have 8 months after the employment ends, and then once B starts, you have 6 months still to enroll into a Medigap policy. All righty. Any more? Okay. Got another question coming here, if you're still with me. That's all right. Okay, you're correctly told when I turn. You correctly told when I turned 65 last year not to accept Medicare, as I work for a company with more than 20 employees. My wife just turned 65 this month and is on my company insurance. Can she defer Medicare until I lose my insurance? And absolutely, she can. Now, if she's on Social Security, she is going to have to take Medicare A only, but she doesn't have to take B. If she's on nothing, she can be just like you and defer. But remember something, folks. Listen. If you're not contributing to an HSA, go ahead and enroll in Medicare A only, okay? Yeah, I know they pay second, but if you were hospitalized, they may pay something. So I definitely would do that. But if you have an HSA, do nothing. So she is fine to defer just like you did. All righty. Any more? All right. Is there a Part A deductible? Yes, there is. Part A deductible this year is $1,676. Now that deductible is your full max out of pocket for a hospital stay from anywhere from 1 days to 60 days. It doesn't matter whether it's 1, 2, 10, 50, 60, doesn't matter. You pay $1,676. Now, that A deductible is not annual. It's called a benefit period. And a benefit period means you're admitted to the hospital, benefit period begins. Let's say you are discharged 7 days later. Your benefit period's not over yet. From the date of discharge, that same benefit period we're in for the next 60 days of being discharged, which means if I go back to the hospital within that 60-day window, same deductible, same benefit period. But if I'm in the hospital, I'm discharged 7 days later, 60 days goes by, nothing happens that would cause me to be hospitalized, and then happens after that. Then I go back to the hospital. If that happens, then I start a new benefit period and I owe another $1,676. That's the way the A deductible works. All right, you mentioned that supplemental insurance is portable, and when moving to a different state, it may be re-rated. Do they reassess your health issue? Great question. No, they don't. No, they don't at all. I promise you. I wish I would have clarified that. Chris, yeah, in other words, that's a guaranteed renewable policy regardless of where you live, regardless of health conditions. They cannot cancel ever as long as you pay the premium. They can just simply re-rate your premium only, but you don't go through underwriting again. Yeah, great point. All right. Plenty Grace, you mentioned that Part B as well as Part D premiums can be affected by IRMAA, correct? How would Part D premium change since that is a private insurance? Okay, well, here's what happens. Part D premiums are set by the insurance company. The IRMAAs are established by Medicare based upon your modified adjusted gross income. So let's just say that we have an IRMAA. Let's say it's the first level. Let me see what that chart is. I think this year, the first level of IRMAA is about $76 on the Part B, $76, because a certain income level, single, I'm above 106, married, I'm above 212. So let's say I have a $76 Part B IRMAA. I enroll into a drug plan. Let's say the drug plan costs $20 a month. I'm going to pay a $20 premium to the drug plan, but then Medicare is going to charge me an additional Part D IRMAA. I think that IRMAA is about $13 and some change. So that's how it happens. Anytime we have a Part B IRMAA, we have a Part D IRMAA. And those IRMAAs are billed directly to us by the government, or they take it out of our Social Security check. The Part D plan is paid to the insurance company, Aetna, United Healthcare, WellCare, whoever it is. So that's the difference. Hopefully that helps, okay? So you pick out the private insurance, you pick out your drug plan, and the IRMAA is going to be attached to the fact that you do have a drug plan, and then you'll be billed by the government for that IRMAA, B and D. All right, hope that helps. All right, have you heard anything more on how the web GPO changes? No, I haven't. I mean, I know it's going to happen, but it affected 3 million people, and so that's a lot of people. And they're also going to make it retroactive, to December 2023, so they've got to pay a year's in back benefits. So they're still in the process of figuring out how they're going to implement that. And what I've read recently, it could take, upwards to all this year for them to really figure out how they're going to roll that out. But I haven't heard anything definitive yet, but we know it's going to happen. Thank you, Ray, for the question. Let's keep going. Kathy, my understanding it correctly is that once you choose a company for Medigap, I have to stay with that company forever. Not necessarily, Kathy. Let's back up. Let's say a person's healthy. You can change supplemental plans anytime that you want. I mean, in all 50 states, you can change them anytime you want. Supplemental plans are not bound to any kind of an enrollment period at all. So once I have a sub plan, I can keep it for life. I can also change it anytime I want. But to change anytime I want, I'm going to have to go through medical underwriting. So yes, if a person has a lot of health problems, then they're probably going to be with that same insurance company for the rest of their life. Okay. Now, if someone lives in a state where there's a birthday rule, once a year, they'd be able to change that with no underwriting, so their health conditions cannot affect them in any way if they make a switch during the birthday rule. So that's the way it works. So the answer to your question could be yes, if you live in a state where it's not a birthday rule, and if you have health problems or you never could qualify, then that plan could be yours. And by the way, I have plenty of clients just like that. But as long as we go with the right carrier, we should have some fairly stable rates, and you'll be thrilled you have that policy. So even if it does go up some, if it doesn't go up crazy high, you should be fine. Hey, I have people call me, all the time. And they've been my client 3 or 4 years, and they call in and they want to check rates and see if there's an improvement, and we'll shop it for them. And the carrier they're with is still very, very competitive. I had a guy just the other day. He said, Marvin, I want what new rates for my wife and I think she was 72. He was turning 70. So been on a supplemental plan a long time. And we shopped it. We could improve his rate by $2. And we could improve her rate for like $12 or something. He said, not worth the hassle for that. Meaning their rate has been that stable. So if we find a company, because remember folks, if you start at 65, it's going to bump up. But if you want to switch at 70, you're 70, and the new company is going to rate you at that age anyways. So you'll be paying more. But we encourage people, let's shop it every couple years. And we have software to do that. Happy to make those switches if we can.
6:30.
All righty. Any more questions? I can take a couple more and then we'll call it good. Anything that's unique. Yeah, and I'm getting tired too. So we love doing this, and I'm going to take 2 more questions, then we're going to call it an evening, and then we'll be back at it next Wednesday. No, next Thursday. Yeah, next Thursday, 5 o'clock. And appreciate everyone coming in. We'll try to take just a quick. It says, what if I move to another state? My insurance company doesn't operate in a state. Okay, it doesn't matter. It does not matter. What happens is that company still has to cover you in that state. Now, again, you could be re-rated up or down. That's going to happen, but you will still have that same policy. The only thing that can change would be the rate. All right? All right, last question here. Let's take one more, Daniel. We're going to call it good. Been with you an hour and a half, and I love it. I like to keep going, but I'm tired, and my wife's going to have dinner, and I'm excited about that.
Nothing really stands out.
Nothing stands out. Okay, folks, thanks so much for watching. If we can help in any way, please give us a call. We'd be privileged to be your broker, and we'll help you and serve you and do all that we can in this Medicare journey. Thanks so much, and we'll see you either Monday at 5, right? Monday at 5, Medicare Monday, through Facebook, and then next Thursday, 5 o'clock. Take care. See ya.